What you just saw is a classic American story. Hypertension in the US has skyrocketed in recent years, and once it develops, it can be difficult to control. That's why we have developed this groundbreaking new drug. Healthy lifestyle changes are the first prescription, but they may not be enough. Losartan Potassium, known by its generic name as Cozar, may be able to help. Losartan Potassium is an oral angiotensin II receptor blocker used for the management of hypertension. Although losartan potassium is commonly used as an antihypertensive, its therapeutic effects include treating diabetic nephropathy in patients with type 2 diabetes and reducing the risk of cardiovascular accidents in patients with hypertension and left ventricular atrophy. Additional but unlabeled uses for losartan include slowing the progression of aortic root dilation in pediatric patients with Marfan syndrome, and reducing the risk of heart failure for patients who are intolerant of ACE inhibitors. As a selective and competitive non-peptide angiotensin II receptor antagonist, losartan blocks the vasoconstriction and aldosterone-secreting effects of angiotensin II and reduces the physiological responses to angiotensin II. As a result, cardiac venous return and total peripheral resistance are decreased. Losartan is also a uricosuric, blocking the uptake of uric acid and promoting the filtration and secretion of uric acid by the kidneys. Adverse effects of losartan may include the following: kidney problems, including pain or difficult urination, urinating less than usual or not at all, swelling in the feet and ankles, and feeling tired or short of breath. Losartan can also cause hyperkalemia, marked by nausea, weakness, tingling feelings, chest pain, and irregular heartbeat. Hypotension is also a potential adverse effect, marked by the feelings of lightheadedness or dizziness. Further adverse effects include diarrhea, stomach pain, headache, insomnia, cold and flu symptoms, muscle cramps, and leg or back pain. Use caution when taking losartan along with cytochrome P450 inhibitors, potassium-sparing drugs, and non-steroidal anti-inflammatory drugs. Avoid food rich in potassium, including potassium supplements or salt substitutes containing potassium. Losartan is also contraindicated during pregnancy, but current literature is inconclusive as to whether or not losartan can be excreted in breast milk. The dental hygienist should take the following cautions when treating a patient who is taking losartan. Recognize potential hypertension and monitor blood pressure. Incline the patient slowly at the end of the appointment and have the patient sit upright for a few minutes before standing. And finally, educate the patient about the adverse effects of losartan, healthy lifestyle changes they can make, and potassium-rich food sources to avoid.